Preparing a patient for cardiac surgery requires comprehensive nursing care that addresses both physical and psychological needs. Preoperative management sets the foundation for successful surgical outcomes and smoother recovery periods. Nurses play a pivotal role in assessment, education, and providing emotional support to patients facing cardiac procedures, ensuring they enter surgery in optimal condition both physically and mentally. Comprehensive patient assessment. Medical history evaluation. The nurse must collect detailed information about the patient's cardiovascular history, including previous cardiac events, history of myocardial infarction, angina, or heart failure episodes, existing cardiovascular conditions, hypertension, arrhythmias, congenital defects, or valvular disorders, previous surgeries, especially cardiac interventions or complications from anesthesia, current medications, particularly anticoagulants, antiplatelets, beta blockers, and ACE inhibitors, allergies to medications, contrast dyes, adhesives, or latex. It's essential to note medication compliance patterns and recent changes in medication regimens. Some medications may need to be continued until surgery, while others require discontinuation several days prior to the procedure. Physical examination with cardiopulmonary focus. The physical assessment for cardiac surgery candidates requires special attention to the cardiopulmonary system. Vital sign assessment. Establishing baseline heart rate, blood pressure, respiratory rate, and oxygen saturation. Heart auscultation. Identifying murmurs, gallops, rubs, or irregular rhythms. Pulmonary assessment. Evaluating breath sounds, respiratory patterns, and signs of pulmonary congestion. Peripheral circulation. Checking capillary refill, peripheral pulses, and extremity temperature. Edema assessment. Documenting presence, location, and degree of fluid retention. Additionally, the nurse should assess for signs of cardiac decompensation such as jugular vein distension, hepatojugular reflux, or increased work of breathing. Any acute changes should be immediately reported to the surgical team. Laboratory and diagnostic evaluation. Preoperative nursing management includes ensuring all required diagnostic tests are completed and results are available for review. Blood investigations, complete blood count, coagulation profile, electrolytes, renal function tests, and cardiac enzymes. Cardiac imaging, echocardiogram, coronary angiography, cardiac MRI, or CT as ordered. Electrocardiogram, to establish baseline cardiac electrical activity. Chest X-ray, to evaluate cardiac size and pulmonary status. Pulmonary function tests, especially for patients with concurrent respiratory conditions. The nurse should verify that these results are documented in the patient's chart and any significant abnormalities are communicated to the cardiac surgery team. Preoperative patient education. Preoperative education significantly reduces patient anxiety, improves compliance with postoperative recommendations, and contributes to better outcomes. This education must be thorough yet adapted to the patient's comprehension level. Surgical procedure explanation. Patients need a clear understanding of what to expect during their cardiac surgery, type of procedure, whether it's CABG, valve replacement repair, or another cardiac intervention anesthesia process, including pre-medication and awareness that they will be completely asleep. Surgical approach, traditional sternotomy versus minimally invasive techniques. Duration expectations, approximate length of the procedure in recovery room stay. Cardiopulmonary bypass, simple explanation of how the heart-lung machine functions if applicable. ICU environment orientation. Most cardiac surgery patients will transition to an intensive care unit following their procedure. Preparing them for this environment helps reduce postoperative anxiety. Equipment familiarization, monitors, ventilators, intravenous pumps, and drainage systems. Sensory experiences, sounds of alarms and machinery, lighting patterns, and frequent assessments. Communication limitations. temporary inability to speak while intubated and alternative communication methods, visitation policies, family access times and restrictions specific to the cardiac ICU staff presence, continuous monitoring and the multidisciplinary team approach. Post-operative expectations. Preparing patients for what they will experience after surgery helps set realistic expectations and improves cooperation with recovery protocols. Pain management. Types of pain to expect: incisional, chest tube related and available pain control methods, activity progression, from bed rest to sitting, standing, and walking with assistance, nutrition transition, from NPO status to liquid diet and eventually regular meals, tubes and drains, presence of chest tubes, urinary catheters, and IV lines, breathing support, mechanical ventilation initially, followed by oxygen supplementation. The nurse should emphasize that most tubes and monitoring devices are temporary measures that will be removed as recovery progresses. Respiratory preparation. Pulmonary complications represent significant risks following cardiac surgery. Preoperative respiratory preparation is essential for minimizing these risks. Teaching breathing exercises. Nurses must instruct and practice various breathing techniques with patients before surgery. Deep breathing. Proper diaphragmatic breathing technique using the abdominal muscles, incentive spirometry, correct use of the device, including proper positioning and lip seal, pursed lip breathing, for controlled exhalation and improved ventilation. Breathing patterns. Rhythmic breathing exercises to maximize lung expansion. Frequency guidelines. Recommended intervals for performing these exercises post-operatively. It's beneficial to have patients demonstrate these techniques back to ensure understanding and proper execution. The nurse should also explain how these exercises prevent atelectasis and pneumonia. Coughing techniques with incisional support. Effective coughing is crucial for clearing pulmonary secretions, but requires specific technique after sternotomy. Incision splinting. Demonstrating how to hold the pillow or folded blanket firmly against the chest. Controlled coughing. Teaching deep breath intake followed by productive rather than superficial coughing position for effectiveness. Semi-Fowler's or high Fowler's position for optimal lung expansion. Pain management coordination. Timing coughing exercises with pain medication administration. Family involvement. Teaching family members how to assist with incision support. Patients should practice these techniques repeatedly during the preoperative period to build muscle memory and confidence. Early mobilization importance. Setting expectations for early postoperative mobility helps improve patient compliance. Benefits explanation. Preventing venous stasis, improving pulmonary function, and stimulating circulation. Progressive activity plan, from dangling legs at bedside to walking in the corridor. Mobility assistance devices, walker, cane, or staff support availability. Safety precautions. Call light use, waiting for assistance, and proper footwear. Realistic timeline, typical progression schedule for the first days after surgery. Discussing mobility plans preoperatively helps patients mentally prepare for what many find to be a challenging aspect of recovery. Psychological preparation and emotional support. Anxiety assessment and management. Identifying and addressing preoperative anxiety requires specific nursing interventions. Anxiety screening. Using validated assessment tools to quantify anxiety levels. Non-pharmacological interventions. Relaxation techniques, guided imagery, or music therapy. Pharmacological support. Administration of ordered anxiolytics as appropriate. Environmental modifications. Noise reduction, privacy provision, and comfort measures. Spiritual support. Facilitating access to spiritual counselors when requested. The nurse should document anxiety levels and effectiveness of interventions to guide continued emotional care throughout the perioperative period. Family inclusion and education. Family members also require preparation and support. Surgery information sharing, including family and procedural education sessions. Recovery expectations. preparing families for the patient's immediate post-operative appearance communication systems, establishing how updates will be provided during surgery support resources, information about waiting areas, cafeteria services, and overnight accommodations role in recovery, specific ways family members can support the patient post-operatively. Well-prepared family members become valuable allies in the patient's recovery process and experience less distress themselves. Final preoperative preparations. Skin preparation protocols. Proper skin preparation helps reduce surgical site infection risk. Antimicrobial showering. Instructions for using prescribed antimicrobial soap. Site-specific cleaning. Special attention to the chest, groin, and leg areas for harvest sites. Hair removal protocols. Following institution-specific guidelines for timing and method. Skin assessment. Documenting pre-existing skin conditions or integrity issues. Jewelry and nail polish. Removal requirements and rationale. The nurse should explain that these measures significantly reduce infection risk, enhancing the likelihood of uncomplicated healing. NPO status and medication management. Clear guidelines must be provided regarding oral intake and medications. NPO timing. Exact start time for food and fluid restrictions. Medication exceptions. Which medications should be taken with a small sip of water. Diabetic management. Special instructions for insulin or oral hypoglycemic adjustments. Cardiac medication protocol. Continuation or withholding guidelines for beta blockers, ACE inhibitors. Thank you for listening. If you have any questions, you can bring to the comment box. Bye bye, see you in next video.